Alright, my name is Sophie and I will be presenting on the hormonal disease called Addison's disease. So, Addison's is a disease where the adrenal glands are not functioning properly, and adrenal glands have to deal with they deal with stress and your flight or fight response. So what happens in Addison's disease is the outermost layer of the adrenal glands, called the cortex, is destroyed, and that part produces the hormones cortisol and aldosterone, um, which cortisol deals with nutrient movement in the body, dealing with body inflammation. It raises blood sugar and controls the amount of water in the body. And aldosterone controls salt and water levels, which affect blood volume and blood pressure. So as in Addison's, as the cortex is being destroyed, the body does not produce enough cortisol or aldosterone. Um, what causes this is tuberculosis is a cause of it. This isn't super common anymore as vaccines have been developed for tuberculosis, but that was the main cause of it back in the 1800s. It mainly now what causes it is it's an autoimmune disorder, which means the body creates antibodies that destroy the adrenal tissue. So basically, the body destroys the outer cortex itself. Other things that can cause Addison's are long-term fungal infections, and also cancer can lead to it. One way to test to see if someone has Addison's is to measure the amount of cortisol and aldosterone in the blood. And then after measuring those amounts, they can do skin tests and x-rays to um, figure out what type of symptoms are being displayed and to rule out any other potential causes for this. And then also they can measure the amount of antibodies to the adrenal tissue that are in the bloodstream. What happens is you become very fatigued. People experience a loss of appetite and a loss of weight. It leads to low blood pressure, nausea. People have muscle spasms, and basically the biggest thing is that there's a deficient response of the adrenal glands. So when your body does go into that fight or flight mode, you can't cope with that very well, and that doesn't happen as quickly as it should, which can lead to very serious problems if you're in an accident or have a very severe disease. One way to treat Addison's disease is to take steroid replacement pills. For cortisol, that would be taking prednisone, and for aldosterone, that would be taking fludrocortisone. Basically, it's just little pills that you could take 1 to 2 times daily, depending on your weight, gender, all that kind of stuff. And lastly, Addison's is actually a very common disease in dogs. That picture there is a picture of my dog Burke. He has Addison's. And what happens with the dogs is they do not deal with stress well. Their blood pressure gets very affected by it. They have a lot of shaking or tremors, and they need to take medication every morning. And when there is a stressful situation, which depends on the dogs, what is stressful to them, what causes them stress, they may need to take extra medication to help deal with those stressful situations.